Colleague joining me. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome to the programme. Interestingly, I just did an interview with a professor. He's a rheumatologist. They're doing a big study on psoriasis and the link between psoriasis and the form of arthritis that you get if you have psoriasis. So they're looking for people to take part in this big study, which is right across Europe. But that has led to Tom in Rathgormack. He suffers very badly from psoriasis. He said sometimes it can get so bad it actually bleeds. Would you have any recommendations for psoriasis? It's a really nasty skin condition, isn't it?
Very nasty. Like psoriasis, in my experience, Patricia, is often linked with the gut. It's actually, they think, an autoimmune condition. And what happens is the immune system drives the skin cells to turn over far faster than usual. So they form this they build up and form this kind of plaque of skin. And the skin, of course, becomes extremely dry and can crack very easily. It can be very itchy, and it can be very difficult to deal with. A lot of people will find that they'll use a cream and it helps for a while, but then it stops helping. So my own experience really, and this goes for the psoriatic arthritis as well, I think a lot of people who've got that have IBS. So I think you need to work on the gut and you also need to work on the skin. So there's a couple of things that he could try. I definitely would try a probiotic. There's a couple of very good ones on the market, but there is one that's been specially formulated for skin. It's by a company called BioNutri, and it's called Dermodophilus, DERMO for the skin, and Dophilus, like the bacteria Acidophilus. So that would be a very good one. Or another very good strain for the skin is something called Lactobacillus rhamnosus. And that's another one that will be, that probably is easier to get in a health shop, I think. So that would help with the gut without doing anything else. But if there are food intolerances, it should be they should be identified, and then they should be cut out of the diet for a period of time and allow the skin to kind of heal before they're reintroduced again. So test is good for that. Then in terms of topical things, well, the first thing actually I'd say is put the fat in by taking a very high-strength omega-3 fish oil. And you want one. Fish oils are made up of two types of omega-3, EPA and DHA. And the DHA is better for the skin. So if you could get one that's high in that and take that daily, that helps to kind of waterproof the skin from the inside. And the lovely thing about fish oils as well is they do have an immune modulating effect, so they can be very good for people with autoimmune conditions. And then in terms of balms, so some people get great results from something called Oregon grape root balm. It's by a company called Viridian. You could try that one. We've got a new product here that has just been formulated by a company called Hefaz Terra, and they use mushroom extracts. Now, this kind of came out of a product, Patricia, that we used to recommend for people who were having radium treatment, and their skin would get extremely dry and sensitive and very, very sore, and it was wonderful for that. So they reformulated it for kind of other skin conditions. It's called Myco Serum, MICYO Serum, SERUM. And that can be fantastic for psoriasis as well. So you could try a couple of those things and see how far you'd get.
Okay, hi Anneliese. My daughter is peri-menopausal. She can't sleep. If she's lucky, she might get 1 or 2 hours at night. Sometimes she's so bad she can't actually go to work. She's so exhausted. We've tried everything, but nothing is working. Please help us, Margaret.
So you could come at this from the sleep element, Patricia, but I think really the way to figure this one out is to come at it from the hormone balance level. So the first thing I would ask is this daughter on HRT, because that can actually solve problems for an awful lot of women. So I'd recommend that she goes and talks to her doctor about that. And if she didn't want to take the actual medicated HRT, you can take plant-based HRT. So there's a product here that we find works really, really well for people, and particularly people who have the sleep difficulties. And it's by a company called NutriAdvanced, and it is peri-menopause support. It's a kind of a powder. And we get great feedback on this. It's great for the sleeplessness, the hot flushes. It's great for the low kind of level anxiety that women suffer as well with menopause. So it works across the different levels, and there are some plant-based hormones in there for hormonal balance. So I would definitely try that. The other one that's quite good as well is the Revive Menoactive. So that has got a lot of the same stuff in there if you can't get your hands on the NutriAdvanced one. So I'd come at it from that level, and then maybe try something like magnesium bisglycinate at night on top of that, just to give the body an extra kind of a sleep boost. And they should be available in most health shops. But definitely, if they don't do the job, you want to be taking them for about 1 to 2 months before you could say whether they were working or not. And if they aren't, I would definitely consider HRT.
Okay, hi Anneliese. I'm taking red rice yeast to lower my cholesterol. Can I also take plant sterols?
Yes, you can, absolutely. They work in different ways. The red rice yeast actually is exactly the same as the statin drugs that the doctor prescribes in its pharmacological activity. So it does the same thing by stopping the production of cholesterol in the liver. But the plant sterols work differently. They kind of fool the body into thinking that there is cholesterol in the system, even though we can't utilise it. So the liver stops making cholesterol. And there's a product where you can get them both together. This Cardio K comes in 2 forms now. One is just the red rice yeast, and one is it with plant sterols. So that will be a good one because you get them all in the same tablet.
Hi, question for Anneliese, please. I was recently at an eye doctor and the pressure in my eye is at a high level. Now, not glaucoma yet. Are there any supplements that might be helpful for eye health? I have a healthy, varied diet. That's a West Cork listener.
Yeah, absolutely. I think probably one of the best things is the fish oils, Patricia, because they benefit in a couple of different ways. One is that they would help in terms of thinning the blood. It's always very good for anything with kind of blood pressure, is to make sure your blood isn't clotty and is flowing beautifully. They're also very anti-inflammatory, and the fish oils, of course, are also very, very good for eye health, particularly as well if there's dry eye. So I would get a good omega-3. There is one formulated, actually, they call it Actase, for the eye, an omega-3 for the eye, and it's actually very good value. Another thing you might like to add is lutein, which has also been proven to be very beneficial for eye health. Eye Bright is a herb as well. I know that Viridian do an Eye Bright complex that has a number of different things in there, including lutein. Again, very, very good for the general overall health of the eye. So I would come at it from both of those angles. And if you're working in front of a computer, just make sure you take a break every 20 minutes, even for 30 seconds to 60 seconds, not to be looking at screens, because I think that's one of the biggest things in terms of poor eye health that we're dealing with these days.
Okay, Norma, question for Anneliese. I suffer a lot from chest infections. For example, I've already had 2 so far this year. What can I take to keep them away? And also, could you recommend a good probiotic?
Yeah, absolutely. So I would take the very basics. Vitamin D, vitamin C and zinc are generally, and selenium sometimes as well. The 3 of those, or the 4 of those combined, are the very basics for your immune system. So taking something every day will just make sure that that they're always, you're never going to be deficient with them. And then there's a couple of different products. There's actually one product that I think would be very good. That's the BioNutri Elderberry Complex. It's got the beta-glucans in there, plus your D, zinc, C, selenium, and it's got a little bit of lysine, which is antiviral. So you could take that as your daily one. And then I would definitely have a bottle of the Dr. Claire Mucotone available, ready to go. Some people of our customers, Patricia, they actually take it once a day. It's a blend of herbs, including echinacea, to boost the immune system and to give respiratory infection support. So you can take it prophylactically to prevent it once a day, or if you feel something coming on, you can take it 3 times a day. And if I feel I'm ever getting a sniffle, that's what I depend on. I start taking it 3 times a day, and touch wood, I very, very rarely get a bad cold, and I haven't had to have an antibiotic for chest for years. And then the last thing I'd recommend is something called N-acetylcysteine, NAC, N-A-C. You get it in any health shop, and that can be great for anything chesty. It's a lovely all-rounder, actually, Patricia, because it's also very good for the liver. But the interesting thing is we recommended that a lot post-COVID for people, and a lot of our customers came in saying that they didn't need to take antihistamines in the summer. So it had some, obviously, moderating effect on the immune system and its reactivity as well. So that could be another good one to add. Okay,
Vaughan, would you have any advice, please, on what I could use to ease the pain of mouth ulcers on my tongue?
Okay, yeah, difficult one now. I think really it's all about prevention. So the first thing I would suggest is that you look at your toothpaste. Get a natural toothpaste that has no sodium lauryl sulfate in there, because a lot of the time mouth ulcers are as a result of an allergy to that. Most people find if they switch toothpaste, it clears up. The second thing I would recommend is taking a vitamin C and zinc tablet, really important for wound healing, and make sure that the ulcers heal up properly. So you could take those preventatively. And then the only thing really I could recommend is maybe using a colloidal silver spray on the ulcers itself, because it's a good kind of a natural antibacterial. Really, I don't know, would it take the pain out of it immediately? You might need something like Bonjela, which has a little bit of an anaesthetic in there. But definitely the colloidal silver can help them heal up quicker as well. But really, when it comes to mouth ulcers, it's about preventing them in the first place if you can.
Okay, hi Patricia. Could you ask Anneliese, how much biotin should I be taking for hair loss from the roots?
Okay, so biotin would be generally in a high strength of 5,000 micrograms. That would be what we'd recommend for people. But Patricia, I find the biotin is fantastic for hair quality. But if your hair is coming out at the roots and if it's not growing back, the best one that we've seen results with over the last 10 years is Norcrin. It has been patented and formulated specifically to kind of re-kickstart the hairs that have gone dormant and are not growing anymore back into growth phase. So I think that would be a better one if your hair is falling out at the roots. But biotin for anybody else, 5,000 micrograms is generally the best dose to take. And if you're taking it for 2 months or 3 months and you don't notice a big difference in the new hair growth, it's not going to work for you. You need the other one. Okay,
any advice for somebody who's suffering from toenail fungus?
Yep, so I think the best thing that we have found is the citricidal, which is grapefruit seed extract. It's a very powerful natural antifungal. It comes in a kind of a little bottle of drops. So what I would generally recommend to people is that they would apply it daily around the toe and the foot area where there's the fungus. And I would then do a foot soak a couple of times a week so it gets right under the nail. Now, this takes time, so you're going to need to give it 6 months. The other lovely thing about that is that you can actually also use it in a wash to disinfect your socks and disinfect your cloth-type runners, because if there's fungus in those, they will keep reinfecting you. So you have to deal with that as well. And the other caution I'd say is that the nail often goes black from treatment. But it'll be the new nail coming up that you'll expect to see healthy. It's not going to fix the old nail, so you'll have to wait for that to grow out. And for some people, that can take 6 months.
It's very slow on toenails, yeah. Okay, just finally staying on feet. Any advice, please, for somebody suffering from a Veruca or a plantar wart on the sole of my foot? Not sure which it is, but it's extremely painful. I've tried using the freezing therapy by Scholl over the counter, but no difference. I'm not diabetic. That's from Pat.
Yeah, that's a difficult one, Patricia. The natural treatment for it is using something called Thuja, Thuja. You can get it as a homeopathic remedy that you can take internally. And also Dr. Clare does a wart cream with it on there. So you could try that. Like wart and Veruca, they kind of are similar, so it'll respond to both. It's difficult to get rid of warts, to be honest. Even naturally, I would say is a 50-50 chance of it working for you. Generally, the best thing to do is actually to go to the doctor. If it's not too deep, they might burn it off for you, with nitrogen. That's what I'd recommend. And then you could follow it up with the Thuja and the Dr. Clare wart cream and hopefully get it right down into the roots that way.
But very, very painful.
It's very painful. Verucas can be very painful for sure. And I suppose the only thing for the pain there would be to just wear the corn plasters, to provide a bit of support.
Yeah.
But I think having it burned off, and I do believe there's a well down in Timoleague that if you drop stones into at night time, your warts will drop off.
Okay.
So maybe the same will work for a Veruca.
Okay, Anneliese, we leave it there. Thank you for that.
Patricia.
And thanks for joining us. That's Anneliese Dressel. She'll put up all of the information on her website, healthhubstore.com this afternoon.